Today's topic is about tetanus. Tetanus is an infection that is caused by a bacteria called Clostridium tetani. It is a gram-positive bacteria. That is, if we stain this bacteria with crystal violet or methylene blue dye, then it will retain blue or purple color. The gram-positive bacteria have thick wall of peptidoglycan. The Clostridium tetani belongs to a Clostridia family. Clostridia family are a normal flora that are found in compact soil, and it thrives in low oxygen condition. That is, they are obligate anaerobes. That is, oxygen is really toxic to them. Clostridium tetani is a rod-shaped motile bacteria. For locomotion, they have flagella. They produce toxin, that is tetanospasmin and tetanolysin. This toxin tetanospasmin disrupts neuromuscular system. That is, it disrupts our neuron and muscular system. In this figure, we can see that a Clostridium tetani in high oxygen condition converts into spores. The spores are metabolically inert and resilient in nature. The spores produce toxins. That are tetanospasmin and tetanolysin that disrupts our neuromuscular system. Tetanospasmin enters our inhibitory neuron that we call Ransom cell. There it cleaves the snare protein. Snare are the vesicles that are filled with neurotransmitter that transfer neurotransmitters to neuron membrane. Tetanospasmin enters inhibitory neurons, which after entering, it cleaves snare protein, which prevents the release of inhibitory neurotransmitter like glycine and GABA. From this figure, we can assume that a vehicle is a vesicle. Vesicle transport neurotransmitter to neuron membrane. But in case of tetanus, tetanospasmin toxin breaks the path and does not allow the vesicle to transfer neurotransmitter to another neuron membrane. When Ransom cells are not allowed to work properly along with alpha motor neuron, the alpha motor neuron keeps on firing without any inhibitory control, causing muscle rigidity and spasm. Spasms are the sudden involuntary contractions of muscle. The spore of tetanus enters our body through any type of trauma or wound. The trauma and wound are suitable for the growth of Clostridium because the environment is anaerobic and warm, which helps in the growth of Clostridium. The wounds may be dirty or clean. Dirty wound, for example, from the rusty nails. Clean wounds from any type of sharp knife. The spores enters the body. Tetanus starts with delayed onset. From the injury, it takes weeks to months for showing any type of symptoms. Now let's see about the types of tetanus. Generalized tetanus. This type of tetanus is the most common form. Here the spasm begins from the face muscles, that is, more specifically lower jaw. Then the spasm spreads throughout the body. The spasms are sudden, powerful, long-lasting, and painful in nature. The muscle contracts so hard that sometimes the muscle gets teared and bone fracture occurs. The second type of tetanus is local tetanus. Here the spasm occurs in a localized area where the injury have occurred. Then after few months, it gradually subsides. The spasm gradually subsides after few months. Here the mortality rate is less than 1%. The third one is cephalic tetanus. Cephalic tetanus occurs to the limited muscles that are supplied by 12 cranial nerves. It happens in case of any type of head trauma like skull fracture, eye injury, tooth infection, middle ear infection. Cephalic tetanus is more likely to cause death than any other type of tetanus. The fourth one is neonatal tetanus. It occurs in a newborn where the mothers are not immunized with tetanus vaccine. Sometimes, in case of delivery, the umbilical cord of a newborn baby is cut by non-sterile instrument, which leads to the development of neonatal tetanus. We can improve hygiene standard to treat neonatal tetanus, and we can also immunize pregnant women with the vaccines of tetanus that provides passive immunity to the newborn as well. Let's talk about symptoms of tetanus. It is also called tetanic triad because three main symptoms are seen. First one, trismus or lockjaw. Here the severe to mild spasm occurs in lower jaw. Second one is rhesus sardonicus, also known as Sardinian grin. The spasm occurs in facial muscles, showing abnormal sustained grin. Third one is opisthotonus, also known as severe spasm of body muscles that occurs simultaneously. It results in high arched back and patient resting on high heels on the back of their head. It forms like a arc shaped. Tetanus only affects skeletal muscles, that is, they do not affect smooth muscles and cardiac muscles. The smooth muscle and cardiac muscle function normally. Other sympathetic overactivity is also seen in tetanus, that is excessive sweating, drooling, fever, difficulty in swallowing, breathing problem, irregular urination and defecation. Diagnosis is done by spatula test, serum and bioassay where toxin can be found if present. Clostridium tetani culture. The culture of Clostridium tetani is really difficult. They cannot be cultured like any type of other bacteria in laboratory. Treatments. Here we use tetanus immune globulin, TIG antitoxin that binds to tetanospasmin. Few muscle relaxants, pain medication and supportive care measures are also given to the patient suffering from tetanus. The full recovery of a patient takes months of intensive care. However, we can prevent tetanus by using tetanus toxoid vaccine, that is a vaccine that provides active immunity. If we get any type of cut from any type of object, then we can get a vaccine of tetanus that will provide active immunity to us. The tetanus vaccine is given in childhood and adolescence in three forms, that is diphtheria, tetanus and pertussis.